The Presidential Task Force on COVID-19 says Lagos, Kaduna, and Federal Capital Territory account for 70% of coronavirus infections in the country. Chairman of PTF and Secretary to the Government of the Federation, Mr. Boss Mustafa, lists major indicators of the current increase in cases and transmission across the country. He said the high numbers were further reflected in the increase of admissions to COVID-19 treatment centers and facilities, particularly in the three epicenter states. He said the PTF has surveyed development and actions taken by government around the world, assessed the domestic environment, and has accordingly submitted its recommendations to President Muhammadu Buhari on immediate measures to be taken.
Over the past 4 briefings, the Presidential Task Force has been raising the alert flag on the rising number of infections in the country and the possibility of a second wave arriving at our shores. Recent epidemiology records confirm to the PTF that Nigeria is now facing a rise in confirmed COVID-19 cases nationwide, which is similar to the second wave of infections occurring in other countries across the world. Particularly Lagos, Kaduna, and the Federal Capital Territory have emerged as the new epicenters during this period, with over 70% of all confirmed cases. For example, in the Federal Capital Territory, despite recording an increase of 85% in tests conducted over the last week, the number of confirmed cases increased by 285% during the same time period. And two, these trends point to a higher test positivity rate, TPR, the number of positive cases detected as a proportion of all tests. The test positivity rate was below 5% through September and October, and we have recorded a low point of 3% nationally in late October 2020. However, recent trends in cases has seen this number increase to 10% in the second week of December 2020. The results of the analysis carried out by the PTF further indicate that the current pattern of spread and the surge is likely to be driven by the following factors. 1, lack of compliance with non-pharmaceutical interventions, particularly the disregard for mask use in public, large gatherings as a result of events linked to the Yuletide season, and recent civil demonstrations. 2, further disregard for other public health preventive measures such as hand hygiene and physical distance requirements.